Hi, friends. Welcome. This is Vrinda. I'm your friendly neighborhood allergist, and I'm going to talk today about allergic rhinitis, which is my bread and butter diagnosis. Thank God for allergic rhinitis that gives us allergists that puts food in our plates. So I'm going to talk about it because it's a very common disease. It affects almost 20% of the population. So 20 in 100, 2 in 10, 2 in 10 have allergic rhinitis. The number is huge. Okay, so let's start from the beginning. What is rhinitis? Rhinitis is basically inflammation in your nose. That's how the translation is. It can happen once in a while when you have a viral infection, when you have a cold. Sometimes you have a runny nose, itchy eyes, and all this is so that's like rhinitis because of an infection. When it becomes chronic, so when it becomes over a long period of time, like maybe more than 6 weeks, and when you can identify an allergen trigger to it, so when something that shouldn't cause allergy, shouldn't cause rhinitis, like a virus should cause rhinitis, but does shouldn't cause rhinitis, when an allergen in response to an allergen, your body mounts an excessive immune response, then that is called allergic rhinitis. Chronic rhinitis is not always allergic rhinitis, and it can be caused because of some medications, because of some withdrawal of drugs. It can be because of some other conditions in the body. So, just because you have rhinitis all the time, it doesn't always mean that it is allergic. But for the most part, it usually is allergic. Okay, so allergic rhinitis. Let's talk about what happens. What are your signs and symptoms? Runny nose, itchy eyes, itchy nose. You just feel like always itching. There'll be, especially kids, you see that they're just always going, itching. And because of the constant itching, they even have a line on their nose. Itchy eyes, itchy throat. You feel like going and scratching at the back of your palate. You feel like itching your ears, and you feel like a certain amount of fullness in your ears. You have so much mucus in your nose that you're always constantly swallowing it, and you feel like a drip at the back of your throat. Sometimes because of that drip, you're coughing, and when you cough, you bring out a lot of mucus. These are all signs and symptoms of allergic rhinitis. It's a very distressing illness. You're so irritated, you're constantly itching and can't breathe, you can't sleep. When you sleep, you're snoring. It causes a lot of school absences in children, and even at work you don't feel like you're at your 100% because you can't breathe, and you can't think because you can't breathe. So it's quite a debilitating disease, even though it doesn't kill, but it really does impair your functioning, your day-to-day functioning. Okay, what are the common allergens that you can be allergic to? So we, of course, doctors like to classify things. So it can be seasonal or it can be perennial. So seasonal are some things that just happen in some seasons. For example, in fall and spring, pollen and all these things increase, and so some people just have seasonal symptoms, that they just have their allergies that act up in fall and spring. Versus there are perennial allergens. So these are indoor allergens, especially dust, animal dander, mold, cockroaches, mice. These are all indoor and perennial allergens. Then again, another classification is indoor versus outdoor. So indoor allergens are dust, pets, mold, roaches, mice. Outdoor allergens are tree pollen. Some molds are outdoor. So that's how you classify them. So these are your common allergens. Okay, so we've established what allergic rhinitis is, what is it caused because of, what are the symptoms. Okay. Just going a little bit into what really causes it. So your nose is exposed to the external environment, and it has to be really careful so that it doesn't let bacteria and viruses in, and it lets air in. So that's why it's a very high immune region. Like it's important for your immunity to put its soldiers in your nose to protect it. But when it's protecting you against things that are not going to cause infection, then it becomes aberrant. Okay, So there are these things called mast cells and basophils, which are immune cells in your nose, which, when exposed to these allergens, they release a chemical called histamine, and that is responsible for all the symptoms of allergic rhinitis. Okay. So, what is the treatment? The treatment is allergen avoidance, and in the next few series of videos, I'll make videos on each allergen and how to avoid it in more detail. But if it's dust, avoid dust. If it's animal dander, avoid animal dander. Excuse me, sorry. The next thing to do is, because the chemical that causes the allergy symptoms is histamine, so antihistamines is a treatment of choice for it. Antihistamines are available over the counter, they're medications. There are two broad types of antihistamines. So one is the newer generation, which is your cetirizine, levocetirizine. These are all generic names. Loratadine, desloratadine, fexofenadine. They are less sedating. They can be taken when you want to go, even when you want to go to work. They are as effective as your older generation, which is your diphenhydramine, Benadryl, hydroxyzine. They are the older generation. They're very sedating, and they sometimes impair your functioning. They cause a lot of drowsiness. It's not a good idea to go to work with them. It's not a good idea to drive with them. It's not a good idea to use heavy machinery. So, and as an allergist, we always like our patients to use the newer generation antihistamines. They are available over the counter. Okay. So that's your antihistamines. The third is nasal sprays. So nasal sprays are also of two types. They are antihistamine nasal sprays. So, for example, azalastin nasal spray or olopatadine nasal spray, they act like antihistamines but only act locally. And there's another kind of nasal spray which is nasal steroid, intranasal steroids, and they reduce the inflammation in your nose. They offer a more long-term effect. So antihistamine is just like putting a band-aid on the problem. Like it's not really fixing this. It's not really a solution. But in intranasal steroids, they act locally and they reduce the inflammation, and they give a more long-term relief from symptoms. If your eyes are really itchy, then there are antihistamine eye drops, same like azalastin. There are also decongestant, which as an allergist we don't really recommend to our patients, especially the nasal decongestants like Afrin. They are a complete no-no. They can only give you a relief for 1 or 2 days. This is a chronic rhinitis. It's strongly advised against to use oxymetazoline, which is a nasal decongestant. No, no, no. Okay, no Afrin, no oxymetazoline for allergic rhinitis. It can cause your nose to literally fall off. It can cause addiction, it can cause dependence. Once you stop it, it can cause the rhinitis to come back really bad. So, if there's one takeaway, no nasal decongestants for allergic rhinitis. Okay. And then there is nasal irrigation with saline, or there's another technique called neti pot, in which you put water in one nostril and then it comes out from the other. It irrigates the nostril. There's like people either love it or hate it, so it's something that you will have to try and see for yourself. Okay. And then the another treatment, it's been here for years, is allergen immunotherapy, in which we if you go to the allergist, they'll test your blood or your skin and see what you're allergic to, and based on that you can get a small portion of what you're allergic to, either in your skin or in your mouth, and then we desensitize you. And there's another video on allergen immunotherapy. Okay. So this is basically going over broadly the treatment. Please leave any questions in the comment section below and I'll be happy to answer it. There'll be more videos coming on individual allergens and how to avoid them, and on allergen immunotherapy, how to use nasal steroids. So stay tuned.